Good afternoon. At our session today, I'm going to take you through some of the data that we have on the spread of COVID-19 across the Isle of Man. Government is sharing an increasing level of data on our testing and results for coronavirus, going back to the start of the pandemic and case number 1 in the Isle of Man. But first, turning to matters more solemn. We've been working over the last week to begin additional reporting around community deaths, which can take longer to verify as we need to establish and certify a cause of death. It is my sad duty, therefore, to advise that the island's death toll from COVID-19 now stands at 6. There's the 4 at Nobles Hospital, and now, sadly, 2 confirmed within the community. Turning to the figures, the total number of confirmed cases on the island now stands at 296. 11 people are being treated in hospital. There have been 2,375 tests, of which we've had 2,319 back. 180 people are now presumed to have recovered from the virus, leaving 110 active cases. Issues around COVID-19 in care homes in the UK have very much been in the news this week. They are home to some of our most vulnerable citizens. It was particularly important from the start of the outbreak that residents were shielded as far as possible, and the lockdown meant a number of restrictions, including no visitors. Nonetheless, we are not immune to these issues. The public will be aware that there is a cluster of positive cases in a nursing home, currently 37 identified cases in the south of the island. The Department of Health and Social Care stepped in to assist with the care of residents and have taken over the running of this home with effect from Monday late afternoon, and we have members of our nursing, infection control, operational management and housekeeping teams supporting the existing staff on site. Families and staff have been updated on the actions of the department and will continue to be supported directly by DHSC throughout. At this time, I'm not able to comment any further regarding contractual matters with the registered provider. Returning to the figures themselves, we will report these figures separately to ensure no undue impact on our modelling, which is crucial to understanding the spread of the virus in the community as a whole. We will, of course, be crystal clear on the overall number of cases wherever they occur. We need to understand where there are contained mini clusters, but we must also ensure we present a meaningful reflection of the extent of the virus among the island's population. Looking at new information coming from our contact tracing team, we are building a daily comprehensive picture across all active and passive contacts, and will be using this and specific detailed information that sits below to support our ongoing management of the virus spread on the island. The first chart I've got to show you shows the spread of individuals who have tested positive for coronavirus in the Isle of Man across age groups. The spread is starting to move across the full spectrum of ages. However, it is still interesting to note that the age bands under 65s have most positive test results, although obviously that profile may change over the coming weeks and months, but it is something we are still seeing. This graph clearly illustrates that this isn't a virus that just attacks the older members of society, and shows why we must all heed government advice and guidance, and that is currently to stay indoors, save lives and protect our health service. The next chart breaks down confirmed positive cases of COVID-19 by gender. A fairly even split, but slightly more female at approximately 56%, shown in the chart as 163 cases. I have been asked on a number of occasions how this virus has affected our health workers, and the following chart specifically shows this. You can see we have had 47 positive cases amongst our healthcare workers, 30 are active, 4 hospitalised, and 13 that have been discharged or presumed recovered, as we usually refer to this. And the final chart shows how the virus has been spread. The largest section, as you can see, is by close contact at 40%, which again highlights the importance of social distancing. I think you will agree that this shows we must stay strong. This virus is indiscriminate of age or gender. Being a particular type of person will not protect you from contracting this virus. We are doing well in the circumstances, but we must retain our discipline and adhere to the social distancing guidelines that are currently in place. If there is data you would like to see or access, we will do our best to provide this, as long as it does not involve personal information or it is not too much effort to compile. And I will now turn to questions. And first up, I've got Leanne from 3FM.
Good afternoon, Minister.
Good afternoon, Leanne.
Sadly, you confirmed that the death toll on Ireland now stands at 6. You've also said 2 have been in the community. I was wondering if you could give any more detail on what community testing actually entails and how it differs.
So community testing is what we're doing up at the grandstand, for instance. So it's people who will go through the drive-through portion. The other testing is testing of people in the hospital. So when we talk about community deaths and hospital deaths, that is the difference. There is a different process for both. Hospital deaths, for instance, because they're under 24/7 medical care, it's an immediate certification of cause of death because it's been established over that time what they're in hospital suffering from. Whereas with community deaths, we have to actually go through a process where the death has to be certified, it has to be confirmed what the cause of death actually is. And that does mean that there's a lead-in time between the figures of confirming community deaths in relation to COVID-19. But whereas the UK is currently only reporting deaths from a hospital environment, as I've said from day one, we will actually report across the board. And tragically, we have now had confirmed 2 community deaths.
Thank you. And my second question, today the World Health Organization has warned there's no evidence antibody tests show coronavirus survivors won't catch it again. But on that topic, is retesting all those presumed recovered here something the island would consider?
Not at this stage in time, because the evidence doesn't support that. The World Health Organization, quite rightly, is taking a very cautious approach. It's early days of this. This is a brand new virus that we've never had to contend with before. So we don't know how long any potential immunity might last. Some viruses you get immunity for life. Other viruses you get immunity for a short period of time. So the truth with COVID-19 is we just don't know. So it is a wait and see, and the World Health Organization quite rightly is being cautious around that. But the evidence from around the world at the moment does not lend itself to saying everyone should be retested. And if indeed it does emerge that the immunity is only for a period of time, that testing wouldn't potentially help anyway, because again, testing is a snapshot in time. You can test someone on the Monday, and that tells you the position of that person on the Monday. It doesn't tell you their position on the Wednesday, Thursday, Friday later in the week.
Thank you very much.
Next up, I have Paul, MTTV.
Hello, David, Minister. Just can we be clear, this business about community deaths, does that mean in the nursing homes? Is that again separate from that, or are we talking about this particular nursing home there's been some deaths or not?
So in relation to community deaths is anyone who's out in the community. So for instance, if someone died at home, if someone died, so it includes nursing homes, but anyone who dies out in the community. So if someone died at home, that would be a community death. So the 2 categories. Are these 2 deaths
in a nursing home, I guess, is my question.
The 2 deaths did come from a nursing home, yes. In total, there's been 3 deaths from a nursing home, but one of those was in hospital. So
and family clusters, and all that sort of thing to do with the nursing homes, how are you registering that? Because obviously there's a massive amount of that one nursing home. Are there now reports in other nursing homes?
There isn't widespread cluster reporting from other nursing homes. I may need to make it absolutely clear. At the moment, the only nursing home cluster we have is this particular nursing home. DHSC has stepped in to assist. As I've stated, we are helping with the housekeeping services. We've got support on the ground in terms of operational support. We've also got nursing support as well in there to help the existing staff be able to cope with this. There's very strict rules and regulations around how you deal with an outbreak in a nursing home, and those are being followed with support from DHSC.
Obviously, great deal of worry for relatives at that particular nursing home.
Exceptionally, obviously concerned. That's why we have been out to speak to the families. DHSC has been contacting the families to explain the situation and actually what we're doing. I've spoken to several of the families personally who have actually been reassured by the steps that DHSC are taking by going in to support the nursing home in this way. Obviously, it's not 100% comfort. It's deeply scary for both residents, workers and relatives when something like this happens, but what matters is how we actually respond to it when it does occur. Okay, next up I have Josh from ITV.
Thank you, Minister. Following the Treasury Minister's announcement yesterday, we keep seeing the graph that shows the expected daily confirmed cases if we maintain social distancing. And based on that, we're not at the peak number for even the best case scenario. So based on that, why does the Council of Ministers feel some people could now return to work and potentially compromise the rate of confirmed cases?
Well, it's absolutely crucial that anything we do doesn't compromise the rate of confirmed cases. And that's why, as I think I've stated at previous press conferences, it's not a case of going from lockdown to normal. You can't do that. It's got to be a staged approach, and we've been speaking and engaging with our clinicians, and there is a belief there's certain things that we can unwind where it's done on a risk and clinical basis, because every single sector and every single industry in terms of work will have to be clinically assessed around what the risks is. So we're not going to go straight from lockdown to suddenly saying everything's back to normal, everyone's back at work. It'll be done sector by sector on a clinical risk-based approach. So we're not just going for a complete open up of everything. It'll be done over time. And the other reason, which I emphasised the other day at this press conference, that we need to do it that way is because any action we take today tends to have an 8-day lag in terms of actually seeing the effect of that action. So it is important that as we start looking at what across the world is being termed an exit strategy, we do take into account that lag and ensure that we do it step by step by step. So it will be baby steps.
So based on those clinical risks, you said, what health factors will you be looking at to determine whether someone is able to go back to work, and will someone who is presumed recovered from the virus be eligible to return as well?
So, for instance, some of the things we'll be looking at is how easy in that particular industry is it to maintain social distancing. What are the risks around them coming into contact with wider members of the public? You'll also look at what is the impact if someone was infected and went back into that industry. How would that potentially affect the case numbers and that curve you referred to on the graph? So there's a myriad of different clinical things that the clinical leadership team and public health will be doing. But I need to stress that any actions that are taken and the data is still being analysed will be taken based on that clinical advice.
Thank you.
Okay, next up I have Alex, the BBC.
Good afternoon, Minister.
Afternoon, Alex.
You mentioned there are 37, I think, cases in that nursing home in the south of the island. Can you confirm whether that's just residents or whether it's staff who have been affected by it as well? What the breakdown is there, please?
So the 37, I believe, is residents. I believe the 37 breakdown is of residents within the home that have tested positive.
Thank you. And could you just give us some more details about the DHSC's protocol in assuming the running of a care home like this? Why did you step in, and what's being done differently there now that DHSC staff are on site? Right.
Well, the first thing I need to say is we've stepped in, not taken over. That's a very, very important point to emphasise. The licence currently has been suspended for the licence provider, but they are still the licence holders, and we're simply operating the services on their behalf. So we haven't actually physically taken over the home. They still own the business, they still own the building, and it's very, very important I emphasise that point. So what we're doing is we're providing help and guidance. So we're providing guidance around how you contain an outbreak like this, on the correct use of PPE, around how housekeeping services continue to operate when you have people who are COVID positive, and how you deal with those residents and how you ensure that there's social distancing within the home to ensure you don't end up with a wider outbreak with staff contracting it and then taking it out into the community. So it's around help and guidance that what we're actually providing.
Thanks.
Okay, next up I've got Amanda from Jeff the Mongoose.
Thank you very much, Minister. And can we pass on our condolences to the families of the recent victims? Yesterday, it was announced that construction and horticulture sectors may be able to go back to work from Friday. I know you cannot share many details, but is this potential move part of a plan to move forward to begin to allow all workers back into the economy, or is it more of a review of whether the initial guidance was too strict?
Well, no, it's not about the initial guidance being too strict. The initial guidance we took was the correct clinical guidance. And in fact, if you look at the graphs that I keep referring to and the green line, you can see that it's been working, the guidance that we've taken. But we've got to recognise you can't stay in permanent lockdown forever. It's just not physically possible. You've got to have, again, this dreaded word that keeps going on around the world and in the international media around an exit strategy. You've got to have that done. So every single industry, as I said in answer to Josh, will be assessed across a clinical basis. So we'll be looking at risk factors, including social distancing. How easy is it to do it? What's been the experience in other areas of the world, in fact, because some areas of the world have already started opening up sectors, some with more success than others. So we'll be looking at that evidence as well. And from there, we'll be taking a step-by-step approach. So I need to emphasise again, we're not going from lockdown to normal. It's got to be phased and it's got to be based on the advice of our clinicians around what is the safest thing to do for each sector. So there will be some sectors that may well not reopen for quite a considerable period of time, but every single one will be done on a risk-based approach.
Thank you. And for our second question, with the increased capacity and speed of testing with the new testing centre opening next week, is it possible that the government may start testing people at random, regardless of whether they have symptoms or not, to get an indication of asymptomatic cases in the community, which has been going on in Iceland, where they have been very successful in slowing the spread of COVID-19?
At the moment, we're not focusing on randomised testing, and the reason for that, which was explained at the press conference the other day when I had the Director of Public Health here with me, is what we are focusing on to begin with is key workers, and being potentially able to get key workers back to work who might be self-isolating, but also we want to look around the entire care home piece as well, the most vulnerable in society, and potential testing and randomised testing there before we expand out into the wider community. We do have our own testing facility, but let's remember it's not a never-ending capacity, so it does bring us up to 200 potentially a day we could be doing, and we will look to utilise that capacity, but it's important as well that we don't do anything that undermines our general community testing, because we want to continue with this, and that's the big thing we have done different as a jurisdiction to some others, such as, for instance, the UK, that stopped community testing, went to only testing people in a hospital setting and lost track of the virus in the community. We have continued with our community testing throughout, and what we want to do is use that expanded capacity to potentially do it. But I have to caution again, the issue with randomised testing is it is a snapshot in time. So you may test someone on the Monday, but that doesn't stop them coming into contact with someone with the virus on the Tuesday or the Wednesday, and their result would come back on the Wednesday negative because they were tested on the Monday. So while randomised testing has been beneficial in some areas such as Iceland, which you mentioned, we do also need to be aware of the constraints of that, and we need to make sure that where we target our resources actually has the greatest benefit for us.
Thank you very much.
Next up, I have Tim from Manx Radio.
Fast am I, Minister. There's quite a lot of concern, as I'm sure you're aware of, within the construction industry about the return to work, and there's confusion about, we've heard from you at previous press briefings saying that we're weeks behind the UK, and we've heard also that you said at previous press briefings that the island is different. What assurances can you give to the construction workers that it is the safe thing, if it is announced next week, to go back to work?
Well, I need to emphasise again, no announcements have been made yet. So I do need to absolutely emphasise that, and it'll be done on clinical evidence. But I want to combine the two phrases you just used up there, where I've said, we're weeks behind the UK, but the island is different. The difference is we've been able to take different measures from the UK. So we've been able to impose a border closure, which the UK realistically hasn't been able to do. We've been able to continue with the community testing, so we've managed to keep track as much as we can of the virus in the community. So we've got a better data source of spread. One of the things we're also seeing is here in the island, and I can't praise the community enough for this. People generally seem to be obeying the rules better than they do in some parts of the UK and other jurisdictions. So people are maintaining social distancing. They are listening to what's being said. You will always have a minority who don't, but the vast majority of the island have realised the seriousness of this and have been applying the rules. And that is the greatest thing that will have an effect. So what I would say is there will be any return of any industry, there will be clinical guidance behind that. And the Treasury Minister mentioned that at the briefing yesterday, where he said not just that there'd be the announcements from the Chief Minister, but also myself as Health Minister, there would be guidance coming as well. So it's not a case of everything just shifts back to normal. There will be specific guidance for specific industries.
Obviously a very sad day again, and condolences to the families involved, but looking for crumbs of comfort in the figures that are out this morning, it seems the awaiting results and awaiting test figures are coming down. Is that something you're observing too?
I mean, obviously, once we move to our community testing and on Ireland, and that facility now looks as if it will be up and running on Monday, then our amount of tests outstanding will dramatically decrease because we'll be doing them locally. So we'll have that capacity to turn them round in a much quicker time frame. The number of tests being requested and going through 111, as I think I said at a previous briefing, is coming down. And that's why we've been able to look at what we can do with our spare testing capacity around key workers, around potentially care home environments where we've got the most vulnerable people, and even what Amanda referred to ultimately around randomised testing. But I think that's a bit further down the line than we currently are at. So there is a whole piece we can do with our testing, but it is encouraging because it does tend to suggest that things are under control. But you know me, Tim, I am cautious by nature. And I don't believe 1 week's worth of data necessarily means we can all start breaking out the party poppers. I think we have to wait and see what the longer term trend is. Okay, and then he's waited patiently to the end for me again. He was last time I was on. Sam at Isle of Man Newspapers.
Good afternoon. Good afternoon, Minister. Just in terms of the numbers of health professionals, can I just clear this up first on? Is it for currently hospitalised?
So I believe that is the current status, is my understanding.
So that's over a third of all hospitalisations are healthcare workers?
Well, let's not forget, no, because let's not forget, Sam, that obviously there's people in hospital as well. For other things. So in terms of COVID-19, there's people awaiting results. But we've got to talk about what we mean by healthcare workers. So we're not just talking doctors, nurses. We're talking people in the wider community, people who are maybe working in nursing home environments, anything like that. It's not just doctors, nurses, which many people would associate with healthcare workers. And it doesn't mean either people shouldn't extrapolate from that and say, well, that makes the healthcare environment unsafe, because that's not necessarily their means of transmission. As you saw from the other graph, the primary means of transmission is close contact and community, so rather than work settings.
Well, actually, yes, that's where I was going next, actually, in terms of this. So with terms of contact tracing then, is there any sign that these people have picked up from within a healthcare environment, be it a hospital or a care home or anywhere else?
My understanding, in terms of a couple of them, I believe, have been workers in a healthcare, in a nursing home environment that have picked them up. But in terms of the general healthcare environment, no. my understanding is that there isn't any evidence of that.
Okay, thank you. And then just secondly, then how many, in terms of the number of people awaiting tests, do we have in hospital at the minute? Then?
So, well, the problem is that figure is going to become redundant because, as you know, I've given that figure at previous briefings. One of the reasons I've stopped doing that generally is actually deliberate. And the reason being, we've now taken a policy that anyone who gets admitted to Nobles gets tested, regardless of why they've been admitted. So the number is a false number now, because it's not just people who, say, for instance, would be on the COVID ward because they're showing symptoms of COVID. It includes all patients that are coming through Nobles. So it's not really a figure that actually anymore holds any sort of particular credence.
Okay, well, I suppose I'll just ask quickly then, how's the Chief Minister doing? Is he back at work next week?
I will echo what the Treasury Minister said yesterday. He is absolutely fine. He's back to his old self. He's seeing out the 14 days. I think, I know the Treasury Minister said Tuesday, but as far as I'm aware, his 14 days is actually up Monday. So he should be back with you on Monday. And you can see for yourself how good he is. He's been chairing meetings, council and ministers and the National Strategy Group virtually. We had a National Strategy Group meeting this morning, and I've been speaking to him pretty much every day. So he's back to his good old self.
Thank you.
Okay, Paul, and then Leanne.
So I'm just trying to get my head around these numbers that have gone up, because obviously it appears that basically this one nursing home has added most of your numbers. Would I be right? Because the last 5 days positive was 49, last 3 days was 35. So are we counting those people in the nursing home in your overall total? Is that correct? So you're doing quite well then?
Yes. So let's pause the doing quite well bit for a moment with my cautious nature again. But let's say, yes, obviously they are included in the total numbers. They will continue to be reported. As I said in my opening remarks, we will be separating out and reporting separately as well, because we think it is important with the data that where you do get that contained cluster in one particular area, such as a nursing home, that it doesn't completely bias the data. But we do also need to report on the actual physical real number of cases coming through. As I said, there is positive signs amongst the data and the direction of travel that we're going. But I still caution that it is still early days and that any decisions we make off that will be done in a clinically agreed manner. People shouldn't be thinking, oh, this is fine, the island's in a much better place, we're able to just relax and go back to normal. That is still not the case at the moment. And as you will see from the graph, it still only takes a small number of confirmed cases per day to push us the other way. So we have to do everything very cautiously and very slowly. Leanne?
Just one last question. Some NHS trusts in the UK are talking about the possibility of running out of some personal protective equipment, in particular protective gowns. Is this something the island is concerned about, or are you assured we have enough PPE?
Well, one of the things we have in the island is we actually have a huge stock of what are termed reusable gowns. So not the general PPE that's used once and then binned. We actually have a very high stock of reusable gowns that can then be laundered and reused again. So in the hospital setting, we will be going down the route of using them more generally, whereas the PPE single-use gowns, we will tend to use more in the community. So we actually, in terms of reuse gowns, have much better situation than the UK.
Okay, thank you.
Tim?
Yeah, just a quick one on the potential, and I hear what you're saying about cautious. But if it is construction and horticulture, they were mentioned yesterday by the Treasury Minister, doesn't that mean that other areas that impact in there, like amenity sites and suppliers, would also be reopening if that were the case?
Not necessarily. It'll be done on a clinical basis. As I said, so even with construction is a wide industry. We need to get all the data confirmed. We need to get the final medical guidelines. And I think speculating at the moment on which industries aren't going to reopen is not helpful at the moment. I think let's listen to our clinicians, get the evidence, get the data, get agreed what can be done on a safe basis, and then move forward from there. So there will be announcements over the next week, and I know there's a real sort of in some quarters excitement to be able to say, well, what are they, what's happening, particularly people who are working in those some of those industries who feel, can I get back to work? But I've got to stress again, this has got to be done properly, and announcements, as frustrating as it is, will be made in due course once it's been agreed based on the clinical basis. Amanda and then Sam.
The first group of residents repatriated to the island have been at the Comas for a couple of days. Have you made any changes to the repatriation strategy since then? And have there been any issues of people not following the rules?
So in terms of the repatriation strategy, no, there has been no changes. It remains in place. People are now being contacted about the sailing next week. They're in the process, I believe, of being contacted today. I know a few people who've already had contact. But no, the strategy is working. I'll say again, though, it is heartache. It is pain, and I know there's people who are exceptionally unhappy with the strategy, but the strategy is there to protect all of us on the island, not just the people who are already in the community, but those returning residents as well. But also, I'll take the opportunity with you raising that question, Amanda, to put an appeal out, and that is, if people could think carefully before they post on social media. I have seen posts where people are attacking the returning residents, saying, oh, well, how stupid of them to be abroad and everything else. I need to emphasise there's a lot of people who were caught, who'd been off Ireland for a period of time, who were caught by border closures around the world that meant they just couldn't get back through no fault of their own. So while it's important that we realise this has been put in as a protective measure for the island, it's also equally important that we don't denigrate those returning people who, like I say, unless their individual circumstances may well have dictated that even with the best will in the world, they couldn't have got back on Ireland before the border closure. So I would appeal that everyone respects those returning residents just as much as they do the people who are already on Ireland. This is a time for I'm just going to say this is a time for our community to be pulling together, our whole community, not for a time for division.
And have there been any issues with people not following the rules once they've been inside the hotel?
I'm not aware of any. Okay, Sam?
It was just being on gardeners and builders sort of thing. We've had a fair number of them contacting us saying that they've obviously, when they've been out exercising this, they've seen instances where, for example, the grass has been cut at Nobles Hospital or on a school field, and in one case of a public authority's golf course. Why have they been termed key to have their grass cut, and why are their staff being allowed to go to work to do that when the private sector has been told to stay at home?
So in terms of grass cutting, it should only be those that are for maintenance of pest control. So DOI, etc., with the verges and things like that. Some of that, but that has been radically scaled back from where it was, and also there should be social distancing. In terms of the private sector, both window cleaners and gardeners, the actual feeling that came from the clinical body in relation to this was that it's not an essential service. Pest control is, and doing the verges potentially is, because it could spill out into the road, but actually cutting someone's back garden isn't. Now, there can be numerous arguments put for and against that. I've spoken to a lot of gardeners and window cleaners myself, and like I say, we have to do everything in a staged approach, and that those will be industries that will be looked at, that on a risk basis can they actually return. But the advice at the time was absolutely clear that these weren't essential services, and even in relation to DOI and local authorities, the only services that should have been done were those that either required maintenance because the ground would be effectively ruined if it wasn't, or those which were in relation to pest control and keeping the verges out of the road.
I get that, but it's just, I drive past St Ninian's High School every day on my way into work, and you can see it there. They've cut the grass there barely in the past with 10 days. You look at examples like that. Can you see why people are annoyed about this sort of thing, where they're seeing that on one hand, but yet they're told they can't go to work when somebody's gone?
I can fully understand why people are annoyed and frustrated. As I say, I've spoken to numerous gardeners and window cleaners myself over the last few weeks. And like I say, we are looking industry by industry on a risk-based approach as to what will open when. I can't give any guarantees at the moment because, of course, we're still looking at the clinical evidence, but there is certain industries where social distancing can be maintained in a safe way, and those would be the industries we'd be looking at first.
Thank you, Minister.
Okay, well, thank you very much. I'll move on to some shout outs. So a couple of business heroes to start with. Firstly, Simon Niebuhr of Inforum Limited, who has donated 2,500 medical masks to care homes free of charge. Plus Matthew Neal, a manager at Capita, who is supporting his staff while they work remotely, but is also delivering food and picking up medications for any vulnerable members of his team. Next, from the public sector, the housekeeping manager at Nobles, Judith Carey, has been in touch to wholeheartedly sing the praises of the NSC staff who have been redeployed to the hospital to assist the housekeeping team during this challenging time. Jude says, our NSC colleagues have come into the hospital with enthusiasm and have got stuck in without question or trepidation to work alongside our colleagues. They have not only taken on unfamiliar housekeeping duties and tasks in unprecedented areas, but they have unwittingly boosted the morale of those around them. Our colleagues from the NSC deserve a massive thank you for their ongoing support, kindness and sheer commitment to helping not only the housekeeping team, but also our colleagues, patients, friends and family across the hospital during this time. Also, on behalf of the staff at the Isle of Man Ambulance Service, a shout out to the Ambulance Service senior leadership team. They have gone above and beyond to not just protect staff working on the front line through ensuring that we have PPE, which is the envy of ambulance trusts across the UK. They have facilitated bringing online volunteer support staff and cleaning teams to make ready ambulances which have been contaminated, allowing crews to maximise time on the road to assist patients that need help. They are showing great care to the welfare of staff, both in work and those self-isolating at home. So thank you for all you are doing. And can I say a huge thank you to everyone across the island, be they public sector, private sector or just individuals, for everything that you are doing to support our community at this time. It is very, very much appreciated. Thank you very much.
Coronavirus has impacted the way that we live and interact as a community.
And it means we're asking you to help us.
To help our community.
From emergency services to manning call centres.
From community testing
to being there for you when you need us.
We are working hard to keep our island safe at this challenging time.
We're all in this together.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.
For your island, for your community, please stay at home.